Hi guys, Dr. Stu Katzen here with Coach Eve. In this particular video, we're going to be discussing the treatment of the shoulder. In an earlier video, we discussed understanding shoulder problems. And we discussed the things we have to look at, whether it's a joint problem, whether it's a muscular problem, whether it's a ligamentous problem, whether it's a restricted range of motion problem. It could be acute injury, it could be chronic injury, it could be overuse injury. So all these things, it sounds complicated, but these are things we want to rule out if we want to treat it properly. So once we figure all that stuff out, we do a spinal neural evaluation, I do orthopedic tests, neurological tests, check the range of motion. I also palpate the spine, I check to see, we want to rule out, make sure it's not bicipital tendon problem. We want to make sure it's not the rotator cuff problem. We want to make sure it's not an apprehension if it's a joint problem issue. And then once we rule all of that, then we come up with our diagnosis and a treatment. And then sometimes, I will refer a patient to one of the massage therapists that we work with. Sometimes I'll have Coach Terry, Dr. Terry, I apologize, who works at our facility as well, do some soft tissue work if we need to as well. So I can check range of motion. Sometimes I'll have the patient put their arms out in front and have them resist, and I'll push down. If the arm is weak, it affects the origins and insertions of the muscle. So one of the ways, I can take care of people's spines is working on their soft tissue. So sometimes I'll use an instrument called a vibrocussor. I'll often work on the musculature. Sometimes I need to be on the trapezius muscle. Sometimes I need to work on the lat or the anterior posterior deltoid. Sometimes I get right on here in the anterior front. We also work on the pec because the pectoral muscle inserts here, which can affect the shoulder as well. So we just want to make sure this increases circulation, flexibility, has a stimulatory effect on the nerve too. We also want to get on the rotator cuff muscles as well to help stimulate those muscles as again increase mobility, flexibility, circulation. Now, I can also use an instrument sometimes. Sometimes we use instruments because there could be a joint problem. You have the AC joint here. You also have the tendon, right?
Yeah.
So Coach Eve, I know I've worked with her in the past, sometimes develops some tendonitis issue in a bicipital tendon, so I apologize. It can be real sensitive and tender in there. So the treatments we do there. Now also, by using the instrument, I want to have her lay down in a minute because I'm going to show you one of the things which sometimes I call the ambiguous case. People miss a lot often. They're always looking at the shoulder joint. And I always have a saying, I try not to be fresh, but if you step on a dog's tail and the dog barks, is the palm of the mouth. So a lot of times people complain of shoulder problems, and sometimes it's not even their shoulder itself. Sometimes there's other areas that we have to look at. It could be the innervation from the neck. Sometimes the nerve from the neck going into the shoulder could be the major culprit. Sometimes it could be the scapula, the triangle bone here. If it's not working properly, it's going to affect how that shoulder works. So we want to do a biomechanical assessment, see what's going on here. That's why CrossFitters really respond very, very, very well with what we do chiropractically, because it's all biomechanical issues. So one of the things that, sometimes a patient's shoulder's not in proper alignment. So there are times that I'll explain to the patient, I'm going to reach around, and by adjusting her shoulder, I can actually help bring that shoulder back into joint, back into socket, so it's properly moving and coupling properly. Now I'm going to have Coach Eve lay face down on the table, so I also want to demonstrate a common treatment for the shoulder. I'm going to have you put both arms next to your body, and sometimes I'll have her test her shoulder. I'm just going to do the right one for illustration. I'm going to squeeze right arm next to your body, and then I check for the tracking of her shoulder. Now put your right hand on the back of your neck. So each one of these activities shows different things. Put it back down, and basically what we find, sometimes the scapula has rotated laterally, sometimes it's rotated medially. Quite often what I find a lot of times it's gone superior with our athletes because we do a lot of overhead things. So sometimes I'll be using my instrument, I'll come on top of the scapula and go from superior to inferior and try to work on that. Another very common thing I find is that there's stress between the shoulder blades, especially between the second and third thoracic vertebra. That nerve goes right underneath the scapula. So by adjusting this area of the mid-back, it affects the shoulder. And also adjusting the shoulder itself. The shoulder girdle, whether it's the humerus, the bone up here, the scapular bone over here, or the AC joint, also the sternoclavicular joint. That's where the shoulder meets the sternum. So all these things in the area are all tied in again. It's very intricate. You can sit up, Coach. All these things are very intricate, and they're all connected. So you want to look at all the different areas. And we have a saying, we always want to go upstream and downstream for where the problem is. So if it hurts here, it may be the effect, not the cause. So that all being said and done, it pays to get checked, it pays to look at these things, and by fixing it the right way early on, it's going to lead to decreased problems in the future, but also help you out, get the most out of your workouts, get the most out of your performance, less pain, better performance, better function, and being happier. So if you guys have any questions, don't hesitate to ask any of the coaches. If you need some more information on mobility, flexibility, next video we'll be talking about that. And don't ever hesitate to come to the office. We're here to help you if you have any questions. So thanks. Hope you found this helpful.